Hello, in this week's video we're going to be talking about a very specific problem with the lower back, a lateral shift, an issue that can often be pretty easily diagnosed, sometimes misdiagnosed, but it will only respond to a very specific type of treatment. All other treatments it's really not going to like, and it's just going to make the problem worse. But first, let's go through our disclaimer. Dr. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, and Instagram so you can be notified when I come out with new content. Also, make sure you check out our website, thept411.com. We have our videos nice and organized. I also have a blog that I'm starting there, so make sure you check all that exciting stuff out there. So this week, like we said, we're talking about a lumbar spine issue, a lateral shift issue, and it's definitely not a chronic problem. It's not a structural problem, meaning we aren't growing up with some sort of weird scoliosis problem where we're shifting to one side or the other. It's not happening in that thoracic spine where we can develop that scoliosis problem. It's definitely happening down at our lower back region here. And when I say acute, it's not necessarily that it's just happening for a couple of days or a couple of weeks. It's something that's kind of come up with your back pain, and that back pain could have been going on for a little bit longer than just a few days or a few weeks. It could be going on for months, but the big telltale sign is we're having pain in that lower back. Obviously, most of that time that pain's going to be over on one side or the other, and that one-sided pain isn't necessarily just going to be in the lower back. It can work its way down into our hip, side back of our hip. It can start to wrap around up here. It can start going down the leg, down into the thigh, the knee, the lower leg, down into the ankle or foot as well. At any point in time, that pain can start to turn around and go to the front and hit those nerve distributions there. Now, the big thing that we need to do when we're diagnosing this is to see if we actually have this lateral shift or not. Some people it's going to be pretty obvious, other people not so much. But what's going to happen 99% of the time, we have that pain that's more on one side versus the other. Let's say it's over here on my left side. My body 99% of the time is going to shift away from it. My upper body, my shoulder area is going to shift away over to this right side, away from this left side here if I'm having that left side pain. And like 1% of the time it can go to the same side. I have a few theories for why that's happening. Not a lot of people actually know what's going on, but the big thing is we always look at the shift, the direction of the shift for our treatment. But like I said, 99% of the time we're going to be shifting away from that pain. Sometimes we're only shifting away from that pain only because we're trying to get weight off of that side, but we actually don't have this lateral shift. It's just us consciously or subconsciously trying to keep pain off of that painful side. So the big way to differentiate that is we got to do a little bit of movement testing here. The big thing is if we're shifted off to that side, away from that painful side there, we got to try to correct this shift first. So what we're going to do is we're going to shift our upper body towards that painful side, or our hips away from that painful side. So if I'm standing here, I want to see if I can correct this shift and just get me back to the middle. If we're having a lot of pain and we can't even correct that, we definitely have that lateral shift. If I'm working into this, but it's not that painful, I want to overcorrect it as much as I can, see what kind of movement loss I have going this way, and then we're going to compare it going to the other side, going further into the shift, see how much more mobility we have going that way compared to this way. If there's a pretty big discrepancy between that, definitely we got to work into this shift as well. And the other thing is, if we have this shift and we try to correct ourselves and it's not feeling too bad, distract our brain for a couple of minutes and then go back to it and see if we're shifted all over again. If we can't maintain that correction, that's also a good indication that we actually have that true lumbar lateral shift that we have to correct before we can do anything else. Now, in a lot of people, this shift is not necessarily going to be that obvious. A lot of people are going to be crooked. They're going to have this shift for the majority of the time that they've had their back pain, but they're not going to notice it. So you're definitely going to need to look at a mirror and be pretty critical of yourself while you're looking for this. It's not always going to be super obvious, but while you're doing it, stand there and just look at the difference between one side and the other. The best way to do this is to take a look at the space between your body and your arms on each side. Now with me right now, you can definitely tell that I have some space right here between my right arm and my hip, but on my left side, my arm is actually leaning up, resting up against that hip right there. Sometimes it might not be quite as obvious, it might more look something like this, but you can still tell that difference right there from one side to the other. And if we're still not sure if we have this shift, we can actually do a provoking test to see if things get worse, they stay the same, or if they start getting better. The big provoking test is to just work on extending backwards repeatedly. We can do it sitting or standing. If you're sitting, you're just overcorrecting your posture over and over again. Standing, hands are on your hips. We're gonna lean backwards this way. We're gonna work into this nice and slow and cautious. We are trying to provoke this problem. Trying to see if it makes it worse. So we're gonna do this 10 times. If during this, just your symptoms alone start feeling better, we don't have a lateral shift. When we're doing this, the symptoms are looking worse or staying the same, we're gonna take a look at our shift again. If after doing that and our shift is actually getting better, it's not a lateral shift either, and we gotta keep working on these guys because that's more than likely gonna make things better. But after we did it, it's feeling worse, and we look at ourselves and our shift is getting worse, that's definitely a lateral shift, and we always have to address the lateral shift before we can do anything else. If we try to work on this any other way, working into extension or working into flexion, or even sometimes working into rotation, it's just gonna make the problem worse. We're just gonna poke on the problem, it's gonna aggravate it, and nobody's gonna be happy. So to address this problem, we're gonna have to find a wall. We're gonna act like we're still in that right lateral shift, our upper body shifting to the right, or even our hips shifted to the left, a combination of that. We're gonna put the right side of the body up against a wall here. So we come up to the wall, the shoulder and the elbow are gonna be up against the wall. We have to make sure that our hip, our pelvis has nice free movement. It's not getting blocked by that elbow. Sometimes we might have to elevate our shoulder a little bit so that our pelvis isn't running in to our elbow there. And all we're gonna do is place that left hand, that opposite hand, up against our hip. We're gonna let our hips fall into the wall there. We wanna start off with our feet about a foot or so away from the wall. We're just gonna repeatedly work into that wall, holding for a couple of seconds at a time. You're gonna let off that pressure, not let off all the way that we're shifting back into that shift, but just enough to take off that pressure. And when we first start this exercise, it's gonna be uncomfortable. It's not gonna feel good. We gotta work into it slowly. We're gonna see how it feels. So you go into it, pressure on, it's probably gonna make it feel worse. We come off of it, it's probably gonna give us a little bit of relief there. Slowly work a little bit more into it at a time. Don't push it too quickly, and we wanna see how the symptoms are reacting. Most of the time, as we repeat that movement, it's gonna start loosening up. Our pain might start feeling better, or our pain might start centralizing. It might start centralizing right when we're working on it, or it might start centralizing once we've done it all throughout the day. And centralizing just means our pain is moving away from our most distal points, the points furthest away from our spine, and they're starting to work their way up towards that spine. Any pain wrapping around is starting to work its way more back to the back here. The pain's working its way up into the back, or if it's more up in the hips and back, it's gonna start going up and towards the center there. Sometimes if that pain's on one side of the body, as it starts to centralize, it'll start going to the other side before it rebounds back to the middle. But anytime this centralization occurs, even if the pain is getting more intense, if that pain is working its way up towards that spine, that is always a good sign. Be very encouraged that we're going in the right direction and keep working on this. Now, I always start people off with doing sets of 10 to 15 at a time, doing this every 2 to 3 hours, about 7, 8 times a day. You're gonna do this exercise. We wanna do this for a few days before we draw conclusions that it is not helping. If you're working on on this and the pain is peripheralizing or moving away from that spine, and it's staying away from the spine and you're just generally feeling worse and worse, definitely go ahead and stop. Go see a therapist, go see a physician. We got to figure out what else is going on with that back, because it's not just this lateral shift. But if the pain is centralizing or if the pain is getting better, keep up with this. Being able to tell if we're maintaining this reduction of this injury, this reduction of this obstruction there, we got to start working to an extension again to see if it starts reshifting us or if we start getting better again. We got to look and see if we're nice and upright or if we're shifting again. If we're nice and upright and we're not shifting, that's a good indication that we might be able to start progressing, but we've got to take a look at our motion again. We're going to shift ourselves as far as we can to one side, as far as we can to the other. If they're feeling about the same, they're not exacerbating our problem, they're not producing our pains, and it feels nice and symmetrical on both sides. We're not having any limitation on one side versus the other. We definitely need to start progressing this a little bit more, but we're not quite done with the wall yet. We're going to add this extension into our wall exercise. So we're going to set up the same way that we did before, but this time as we go into the wall there, we're going to start extending backwards. So you're going to maintain that pelvis up against the wall there, and you're just going to extend back and then back to the middle. But maintain your hips over there towards the wall as you repeat this movement. You're just going to do this about 6 times each time you do that. And while we're doing this one, we have to monitor our symptoms, see if the shift is starting to come back or not, or if the pain's starting to peripheralize, or if it continues to centralize or get better. Adding this extension, we only need to do that for a day or two. Same thing, about 7 or 8 times a day, every 2 to 3 hours while we are awake. So let's say we've done all this, we've done our shift corrections, our posture is a lot better, we're not shifted off to the side anymore, our pain is nice and in the middle of the back. Now we've added the extensions, it hasn't made anything worse, it either feels the same or it's getting better, but we're not shifting over anymore. Now we need to go straight into that extension there. So we're getting away from the wall now and we're just working into that extension again, that repeated movement here. We're going to start off standing in a more mid-range position here. Make sure that as we work on this, the pain doesn't get any worse. As long as it's not getting worse, we also need to check out, make sure that we're still nice and upright, we're not shifting over again, and we still have that full lateral movement going side to side there. Any point in time during this process though, and you've heard me say it several times now, but anytime during this process, if you feel like the pain's getting worse, it's starting to travel away from the spine again, or it's starting to shift us over to the side again, we got to go back to the wall. We got to abandon these extensions until we get rid of that shift again, and our pain starts to either go away or starts to centralize again, and we get to that point to where we have that pain-free, unrestricted lateral mobility to both sides, and we're not standing crooked anymore. But anytime, and I can't stress it enough, anytime that shift starts to come back, the pain starts to get worse again, we got to go back up against the wall. Now there's a lot of theories on why this happens. Some of them sound legitimate to me, some of them not so much, but there is one very consistent thing that I've seen in clinic with the majority of people that have this problem. It's called a leg length discrepancy, and it makes a lot of sense why people shift over with that. We're going to talk about that in our next video, and something that we can do to help treat that, to help try to prevent this from happening if we have that leg length issue. But we'll talk about that next week, so make sure you stay tuned. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.